All right, y'all. So we are in ICU. ICU living. I have tips for ICU living, y'all. We get to ICU, there's a recliner, a vinyl covered recliner, and there is a vinyl covered little couch that the end extends out so it's long enough for you to sleep on. They're not very comfortable. So I knew I was going to have to spend one night in the hospital, maybe two, for his brain surgery. So I brought my own pillow with a silk pillowcase, tip number one. And I brought my own cozy, fuzzy, soft blankie to cover up with because I wanted my own blanket. I know what hospital blankets are. I wanted my own. So I had those things to keep me comfortable. And I took comfortable clothing. I took leggings. I took thin, long sleeve shirts because hospitals are cold. So I wanted long sleeve shirts, and I took good tennis shoes so I could walk around the hospital without having a problem. Tips number two, comfortable clothes. And don't forget your medicines, because I only took enough medicines for a couple days. So I didn't have my medicine. We were not prepared to be up there long term. And I had enough clothes for like 3 days. But I don't care if I wear my stuff 2 or 3 days in a row. I'm not doing anything. I'm literally sitting here beside his bed. My overnight case with my toothpaste and my makeup and face wash, all of that, went straight into the bathroom. That ICU bathroom, y'all, is for you. Use it. Don't feel bad about walking in that bathroom and using it. Yeah, they got to come in and clean it. But your loved one laying on that bed fighting for their life is not going to use it. You go use it. I set up. I made myself comfortable. Tip number 3, chargers. Make sure you bring chargers for your phone, chargers for your laptop. My husband has hearing aids. I brought his hearing aid charger case. We just got his deep brain stimulator put in. So I had the deep brain stimulator stuff. Don't need to use it yet. But those are 3 important tips. Cozy, comfortable things from home to keep yourself feeling okay. Comfortable clothes that you can layer. And your chargers and everything you think you're going to need at least overnight in a hospital. But ICU, this ICU is great. They allowed 2 people to stay in the room 24 hours a day. And we could have 5 or 6 people in the room during the day as long as we're quiet, not making a ruckus on the floor. And most of the time we all took turns. There was times we had 7 or 8 people in the room, and it was fine. No one ever complained. But at night it was usually just one of us. And I stayed the first 5 or 6 nights and slept in the recliner. You learn how to sleep in a recliner, y'all. They give you pillows and blankets anyway. So you use that extra pillow and you put it over in the crook of the chair, over the arm, so you can kind of lean up there and have a little bit of padding. I slept kind of sideways on my side. I had my pillow tucked over here, their pillow tucked behind my back, my blankie pulled up over me. And I'll just tell you, that soft, cozy blanket that I could just feel and rub, that sensory thing is calming and grounding, and you need that, y'all. The other thing living in ICU is you need breaks. I'm there all night, all the next morning, because the doctor teams make their rounds between 7:30 in the morning and 10:30. So I'm not leaving that room in the morning to go get breakfast or coffee or anything. The kids on their way up stop and get me bottles of water, keep plenty of water in the room for you. They stop and get me bottles of water, coffee, and something for breakfast because they know I'm not leaving. And they want to be there to hear what's going on from the doctor team. And this is like a team. It's like 7, 8 people, y'all. It's every doctor who's laid hands on him in the last 24 hours, every nurse practitioner that works with them. It's a lot of people, 7 to 12 people that come in and give you updates and then answer any questions. And they stay there a long time. They're really nice about that. So have questions ready. But breaks are important. What is this? Tip number 4, breaks. You got to get up and you got to go walk, even if you're just walking around the floor. The kids would make me get up and go down to the cafeteria in the new hospital, which is a nice walk, which is a nicer cafeteria, and get me lunch every day. They made me leave at lunch. Let's get you out of here, get you a break, get you something in your stomach. We don't need you passing out from low blood sugar. So they would make me go to lunch, and I needed that. I needed that more than I thought I did. And they did the same thing for supper. And when we went for supper, I usually grabbed extra bottles of water, a protein shake, and maybe a snack or something for middle of the night, usually a yogurt parfait. I got to eating a lot of yogurt parfaits in that hospital, y'all. But have water and food in the room for you. Because this hospital, the kitchen did not send trays up for you, for the loved ones. You had to go get that in the cafeterias or the snack bars that they had out in the lobbies. And those were only open certain hours of the day. So you have to plan a little bit for those. Tip number 5. My tip number 5 is an eye mask. Y'all, they never darken the room. So if you are staying there and sleeping at night, you need an eye mask because they dim the lights, but they never turn them off. So make sure you have an eye mask and you have earplugs if noises bother you. That heart pump is very loud, but it sounds like a cable tool rig. It didn't bother me at all. The thump, the thump, the thump sounded just like a cable tool rig. So I knew my husband was fine. I knew mentally, I knew right where he was. And it kind of put me there too. So I dozed. The floor kind of shuts down. Very basic things are happening from 10 p.m. to 4 a.m. So you've got 6 hours that you can doze. But the nurses are still coming in and out. We have to turn him every 2 hours from one side to the other. They have wedges and stuff to get him up off of his back and turn on one side to the other every 2 hours. So there's stuff happening all night long. But 4 a.m., y'all, it gets busy. Between 4 and 4:30, chest x-rays. They make you leave the room. 5:30, echocardiogram. They make you leave the room. 5:30 to 6, lab work. You can stay for that. But they're drawing it out of his PICC lines. So they don't need you to leave or do anything. They're drawing it out of the PICC lines. So, but that stuff starts happening at 4 a.m., y'all. And then it's shift change. Nurses are coming in at 6:30, 6:45 for shift change. So then, there's nobody in the room really, or the nurses are in the room, but they aren't dealing with you or him. They're talking to each other, sharing all the information, charting, doing all the things they got to do, preparing for the doctor team that's getting ready to arrive anytime between 7:30 and 10:30. So they have to be ready by 7:30 for that doctor team to come through. And still taking care of their patient and still doing all the things they need to do. Cleaners are coming through. This was a little sweet lady. I'm sure that's not always a little sweet lady. Little sweet older lady who made the rounds every morning, and she scanned every piece of equipment in the room for billing. So I told her, that's a great job. And she said, I love this job. I get in so many steps, keeps me active, keeps me busy, and I get to meet so many great people. And all these people will come in and visit with you, y'all. All you have to say is, good morning. How are you? And they will start visiting with you. But if you don't talk to them, they are not going to bother you. So that interaction is nice to have. Talk to people. Tip number 6 or 7, wherever I'm at. Talk to people. Very important. During the middle of the night, we are down to one nurse. One nurse has 2 patients. Every nurse on the ICU room floor has 2 patients to look out for. And so when there's a problem, my husband had a problem. They had him on a ton of blood thinners. And that catheter site that they went in his groin just bled all the time. And trying to clean that and change that dressing, the single nurse had problems doing that. She went through like 3 packages of bandages before I finally said, I would love to help you. This is my husband. And she's like, well, I'm supposed to just go get another nurse, but they're busy. They've got a new patient. And I said, let me help you. This is what I've done throughout my life. I've taken care of people throughout my whole life. I've done infusions. I've taken care of sutures. I've taken care of a lot of things. Let me help you. So when we talked and she realized that I wasn't kidding, that I could actually handle it, she said, go wash your hands and get some gloves. So I did that, come over, helped her hold things. I just helped her hold things while she was cleaning and trying to get the blood to stop, using blood stop stuff, powders and stuff. Just enough to get that clear bandage over it, which filled up with blood pretty quick anyway. So those got changed a lot. But after that, they let me start helping turning him at night. It took my mind off of whatever was going on in my mind. Gave me something to focus on, made me feel useful, which was wonderful. This is my husband. I love him. I want to do for him. Let me help you guys. During the day, there's all kinds of people. There's a head nurse on the floor who comes around and checks on everything. There's doctors in and out. There's other nurses that come around. They have more hands. At night, they're pretty short-staffed. And these poor nurses work 12-hour shifts, y'all. So they got their hands full. Plus, they're trying to chart everything and do everything. It's a lot. So any little thing I could do to help, I was very glad to help. And I was grateful that they let me. So these are the tips I would say when you're staying in ICU. Comfortable clothes, comfortable things from home, your pillow, your blanket, slippers or socks to walk around. I'm not walking around the floor barefoot. I don't care how many times they clean it. I brought special socks to wear on the floor. So those are good things. And water, plenty of water. I didn't drink coffee before, but I started drinking coffee then because I was super tired. I had no sleep from Thursday morning to Sunday morning. No sleep, y'all. It's a long time. So coffee started Sunday morning. And the kids really got in a rhythm of taking care of me and sitting with him when I was out of the room. Our waiting room was packed with family and friends. We had friends who brought food up for everybody in the waiting room. We had so much help. I had needed help at home with our business and with the animals and the house and the place, and people stepped up to help. And I don't like to accept help. I like to do everything myself. I love to help people. I'm not good at asking for help. Getting help is hard for me, but I had to ask and I had to accept it. Huge blessings, y'all. So ask for help. Tip number 8, ask for help. And accept that help and be grateful for it. And don't feel guilty. You've got a lot on your plate. So handle what you got in front of you. Try to pass off what you can. And enjoy all the love you receive from others, because you're going to receive a lot. Keep your phone charged. Very important. Take breaks, wash your face, brush your teeth. It makes you feel like a human again. Just little things, lots of little things. We were in ICU for 11 days. So it was a long haul. I learned how to live there. And it wasn't so bad.